Hi, everyone. Thanks for joining us at our showcase session. My name is Amy Melman, and I'm Vice President for Government Affairs and Policy for Viasat. Viasat is a global internet services provider, primarily powered through high throughput satellites. We are providing broadband services around the world today with our own satellites and in partnership with a variety of other entities, including in the Asia Pacific region. And shortly, we will be launching a new series of satellites with a terabit of capacity in each, which we're really excited about. Today, I'm joined by Craig Noonan, who is a senior executive leading our telehealth services partnership with a company called 19 Labs. We're going to be discussing telemedicine and the rapid acceleration that we're seeing these days, given the current health crisis that we've all found ourselves in. Craig, thanks for joining us.
Great to be here, Amy. Thanks.
So over the past few months, we've experienced a global pandemic, as we all know, and that has impacted virtually everyone. So how do you see that this has actually changed the way that we look at healthcare?
Well, as we've seen across the globe, we need to think of healthcare as an ecosystem that requires collaboration to be effective. The global pandemic has exposed the holes in our healthcare system, or certainly the ecosystem, including like limits on our resources, both in facilities and staffing, identifying and diagnosing and tracking of cases, care coordination and delivery, geographic challenges, supply chain dependencies, and communication, data gathering, and analytics. So what's the solution? Well, unfortunately, there's no single lever we can pull to fix the problem. The good news is that technology has helped us close some of the gaps in many of those areas. And one of those areas is telemedicine. Telemedicine, as we've seen just recently, telemedicine adoption has advanced probably 5 years in the last 5 months. Once considered a convenience, is now really has become a necessity.
That's for sure. Now, we all, as we see here, are becoming extremely familiar with video conferencing, electronic meetings. So how does this whole world of teleconferencing and everything and telemedicine, how does this impact our current situation?
Well, telemedicine extends the footprint for our healthcare outside of our physical facilities. It expands accessibility and it extends our reach, and really it creates efficiencies. But first things first, telemedicine is dependent on connectivity. Seems obvious, but many of our communities are not or don't have the infrastructure or the bandwidth to utilize the power of telemedicine. And really that extends from our rural areas in the United States to the global emerging economies. The problem is still the same. Concurrently, our population who can most benefit from telemedicine typically is either unconnected, underserved, or can least afford it. But when a situation like COVID hits, there's no discrimination between geographies, income, ages, or genders. Everybody's impacted. So solving the first challenge is connectivity. And so it makes connectivity paramount in this process. Then we can leverage the connectivity to significantly impact our communities by delivering healthcare locally and making it accessible to everybody. Of course, all resources are limited, so connectivity and technology are key to leveraging those resources efficiently. In healthcare, for example, most of our care is dependent on our doctors and healthcare workers, yet every country on the planet has a shortage of doctors and healthcare resources. In a pandemic situation, it only gets worse. We're witnessing limitations daily, so we need to organize and utilize our limited resources effectively.
So how do we best leverage and maximize and deploy all of our healthcare resources effectively?
Great question. Well, first, let's define telemedicine because it has several meanings in different places. Basic telemedicine simply connects our patients and our doctors via video and audio calls. Well, this is great because it's convenient and it does expand our footprint. But this consult is limited to diagnosis by conversation. So to truly impact our healthcare systems, we really need to expand our clinical footprint, but leverage our existing doctors more efficiently. We have a pretty limited resources when it comes to our healthcare workers. We can create remotely connected clinics, providing full clinical experience for the patient while best utilizing the levels of healthcare workers. We typically call this enhanced telemedicine. Think of it as providing a full clinical experience for the patient and the doctor from anywhere. Because we can deploy connected remote clinics in a box, so to speak, integrating diagnostic devices and video conferencing to deliver patient interaction and the patient and to the patient with diagnostic data for the most accurate assessment. This results really in personal healthcare distributed efficiently and cost effectively everywhere. So these clinics are only limited by connectivity. They're operated by community workers, really, which requires a lower skill set, under the guidance of doctors, the highest skill set, during the consult. Simply speaking, we take the clinic to the patient, locally connect the distribution of clinics to impact our communities while creating a network of care for everybody, everywhere. Connecting patients and doctors, nurses, and specialists remotely is efficient and cost effective.
Well, that's interesting because Viasat, as you know, has a Viasat community internet program, which certainly is cost effective and can get to these rural and remote areas easily and certainly efficiently and cost effectively. So I think these things marry together very well. So how, given the current situation, how do you think this actually can impact and help the COVID management today?
Well, specifically to COVID, and this really works through the whole workflow of how we have to approach the problem. So first, these remote clinics, or let's just call them points of presence throughout our communities, can provide the first line of contact and assessment for cases. Think of turning our community centers, our churches, hotels, schools, or even temporary tents into designated remote clinics. This expands the healthcare footprint locally and provides access to everyone. Second, the access is increased, but then when we identify potential cases, both the patient and the progression of the symptoms can be tracked. As conditions worsen, the patient can be escalated then to the hospitals where the beds are limited and care and a higher level of care is needed. So this becomes highly effective in the effective tool in establishing really a triage workflow to manage the finite hospital resources that are so stressed for the advanced cases in need of critical care. Additionally, connectivity coupled with robust management platform can remotely monitor patients, keeping the highest skilled assets, our doctors, physically distanced, and yet allowing the efficiency, allowing us to work better, faster, and allowing them to manage larger patient panels. Visibility and tracking are key as we're managing hotspots. We've seen that already. We have trouble gathering data in real time or even in several days. So through the extension of remote clinics, it expands our footprint and we can capture and then forward the data. This provides the critical information, to accurately predict and track outbreaks for population health management. So think about helping our most vulnerable population. Placing remote clinics with diagnostics in senior centers to provide immediate care to our elderly, and we also lower the risk to them of the virus transmission because they don't have to physically be in front of doctors.
Yeah, no, I think that's critical. As we know, that's been a particular hotspot for many of the patients. So I think that's actually, a key, niche case. So really, really helpful. Is there any way we can see a demo of this particular technology?
Yeah, let me connect up and we'll do a live demo for you, and we'll show you a couple of the features and show you how it works.
Fantastic. while you're getting that launched, as we know, we're all sitting here with our friends in the spectrum world, regulatory and industry. And as we know, obviously, we need to be able to connect to provide this service. So Viasat, of course, uses, fixed satellite service technology, among other things, but primarily that. We are working through the Ka-band spectrum, and it's something that we, are hoping to bring, as I said earlier, the Viasat 3 satellites through to connect the Asia Pacific region very shortly, and looking forward to that. But certainly connectivity is key. My guess is this is, this can be used in any platform, but certainly for rural and remote areas, and even some suburban areas, this is key for connectivity for some of these folks that might not be otherwise able to get, other type of platforms or systems to operate in their areas.
Exactly. So let me take over for a second and look at this. So let me maximize that for a little better view. So what we're doing is really trying to expand our footprint, again, in telemedicine, utilizing telemedicine. So we're really trying to deliver on the promise of creating remote clinics, mobile care and triage, and really effectively providing a mechanism for population health management. So what we're talking today is this really three areas. One is our point of care. So think about this as our remote clinics. It's pretty simple. You can see, and I'll show you a little bit bigger picture in a moment, but this is the case that it's in. You're talking about diagnostic devices and an Android tablet. That is connected to a care provider. So our cloud-based application manages the consult and allows the doctor, the care providers, to control the consult. And of course, that's dependent upon connectivity. And really with Viasat, certainly with 24/3 speeds are more than adequate for delivering value-added services like telemedicine.
And so these are real-time applications, right, that are able to be used on that service?
Absolutely. Real-time audio, video, as well as diagnostic devices and data being transmitted.
Wonderful.
So here's a picture of the kit a little more close up. And so just to give you a quick idea, we are device agnostic, which means we can use any of the clinical devices that are already, doctors are already used to using, and certainly regulatory countries from a regulatory perspective have already approved. They are either connected via Bluetooth to the tablet, or they are connected by USB through a USB port to an Android tablet. Again, these are all off the shelf. These are not. These are readily available. And so the goal here was to drive the cost down of the deployed hardware. So a standard Android tablet. Then Gale, our platform app, sits on the tablet, and then it's connected. And on the healthcare provider side, they see basically a dashboard, and they're able to control the devices and control the consult. The types of devices that we would use at this point, you could just look and see. If you think about going to a clinic and you're working with your doctor, when they're doing an exam, they're using these exact same diagnostic devices, everything from digital stethoscope to pulse oximeter, very simple devices like thermometers, blood pressure monitors. And then you can even move this into a higher level where we can integrate, and we have integrated ultrasound, so we can do this for prenatal care. We have all the way up to a 12-lead EKG or ECG for cardiac tests. For specialty type of applications, we actually have contraction monitors to monitor the progress of delivery. And we can actually do testing in the field. So if you think about diabetes, taking a blood strip, putting in a glucometer, taking the readings and then transmitting that and tracking them. In some areas of the world, like Africa, where malaria is significant, we have the ability to test strips and malaria testing devices. So this just gives you an idea of the breadth of the devices that we have. It is expandable. So as more devices come out with more power, like AI, and we can deploy those to the edge, and we can help pull more data and more accurate data in. So we don't want to limit ourselves to the future. So let's go ahead and fire up now. So here's what I'm going to show you. This is actually our tablet. My tablet is sitting on my desk next to me, so it is live. This is a depiction. I'm going to make the screen larger here, I hope. Let's see here for you. So basically, you'll see how simple this is to operate. So this is an Android tablet. The Gale application is sitting here. On the welcome screen here, basically, is, if you want to, for lack of a better term, we could talk about a marketing screen. So this is totally customizable. So if it's a public healthcare system or a private healthcare system, we can brand it and let the users know who is providing the care. Across the bottom, you'll see 4 different buttons for our navigation. I'm going to start over here with with our guides. So one of the keys to helping with population health management is we need to get information out into these rural communities or into the hands of the people. So we have 3 tabs across the top. So this is healthcare content. It is stored on the edge or in the tablet, so it's readily available even offline. We have community care, we have first aid, and we have emergency type of information. As you can see, even in community care, we've actually created a COVID-19. So this was recently updated. We're giving an overview, symptoms, treatments, and prevention. So a couple of interesting things about these guides is we can update them whenever needed. They can be translated into any language. And they also contain and can contain full multimedia. So it can be audio and video embedded in these educational content. In addition, we can tie it to if it's in a particular country or with a particular standard of care, all of the content can be updated to match those regulations and or protocols for the healthcare system. So we move over here to the devices. So this is in local mode. We're able to, however the kit is configured, all the devices will show up right here. And they can be accessed, and we can take any measurements locally without being connected, just so they can have a local control and local measurements. We go to clinics, and this is pretty unique here. So you'll notice here that we have lots of different clinics. Well, the reason we have lots of buttons here is so you think about this as a router. It's fully flexible. So you can think this could have literally one button on it, which could connect you to whatever healthcare system, if it's a single healthcare system. Think about having the ability to connect to a government healthcare system or a public healthcare system, a private healthcare system, or specifically if it's deployed by a specific doctor group, it could be connected directly to that doctor group. So it gives us full flexibility to be able to choose which set of doctors or which system that you connect to. And even from that perspective, it can even be broken out to urgent care or by discipline. This can be by prenatal care. It could be to cardiology, geriatrics, pediatrics. So depending on the way that we need to serve the community and the doctor resources that we're connecting to, we have a full matrix and a full ability to configure the system for those applications. So I'm going to choose quickly a clinic. So this is the clinic. Now, if you think about walking into a clinic, the first thing you do is we're going to try to, as we mentioned, we're trying to replicate the full clinical experience. So the basic information we need to know when we first get to the clinic is you have to check in at the front desk, and we gather your demographic data. Now, this is important. We not only need the data, but this could be in a rural system where there's no, there haven't had any calls. And from that perspective, you need to capture that data because you need to know who your patient is. You need to be able to track them. So I put in my basic information. Now we need to ask your basic health history, which pops up. And so if you have any allergies, we need to know that if you're a doctor. We need to know if you're on any current medications. We need to know if you have had any, if you have any current conditions that you're battling today. And literally on a medical history, any history, or at least recent history. And if you were in bad shape, maybe we had a heart attack 2 years ago. This is all information that a doctor would want to know that when they're going to serve you or going to treat you. So then the middle box here is a payment information. Again, this is flexible and customizable. So if it's an insurance issue or it's public pay or it's out of pocket pay, this can all be configured to track the payment system, whichever system we need to connect to or account for. And then today, what was the purpose of the visit today? We'll just say that we had a headache and we have fever, which seems to be very common in our pandemic. So we start the visit at that point. And when we start the visit, you're looking at a screen, you're still on the remote screen. And now I'm going to change you to the provider view. So this tab I'm going to put you in the doctor's shoes. This is the doctor's view. And the doctor then is going to be able to manage in this call center. So this is his waiting room. So he can join the call. He looks at call status. We have a call waiting. If we have multiple calls, they stack up just like a waiting room. It has a counter, a timer counter, so they know how long each call has been waiting or each patient has been waiting. Tells them which clinic it came from. Remember, we had the ability to set multiple clinics up. Tells me who the participant is. And then from a meeting information standpoint, we have now all the IT data that we need. And we manage the IT from the cloud. So this gives us all of that IT data. And we give you a device location. So this is a Geo Reference to where the pad is located or the clinic is located. We simply join the meeting to do this. And I'm going to have to move a couple of screens around because we're doing this on a single computer rather than a dedicated setup. So if you'll bear with me one moment while we do that.
So Craig, are all these devices that you're going to show us, are they all easy to use? Are they more difficult? How do you train people?
Yes. So that's a great question. Let me do this very quickly.
Because we know that there's not always somebody who's as skilled in some of these areas, whether it's a teacher in a school who's using these devices or a community leader, but not a nurse or a doctor even at times.
Correct. So the business, the operational model is this, that we would have a community worker who is a lower skilled worker out in the remote clinic. This lower skilled worker can literally be trained in a couple of hours to work the different devices. So they're very simple devices. We have all of the instructions are also built into the information tab. So, but we can actually train people very quickly. And then on the other end, which is your most highly skilled, as we talked about, healthcare worker, your doctors or your nurses on that end. So they're actually, during the call, actually directing the community worker. So the community worker really needs to just to provide the interface, talk to the patient, and take the direction from the doctor as to which device to turn on, and if they need to move the stethoscope around on their back or their chest, then would direct them. But it's live, interactive, with eyes on patient and eyes on directing the community worker. So what you're seeing right here is in the left panel, we're seeing now to the video. The reason you're not seeing anything in this panel is that's accessing. I'm actually acting as a doctor screen right now, and my video camera on my computer is tied to can only be used for one purpose. So normally this would be the doctor in this screen, and this is the remote in the top remote pad. So the doctor then would start directing the patient to say, what are your symptoms? They would have the normal course of action. He would then direct them to start the consult. Now you'll notice when the doctor is looking at his dashboard, he has all those patient details in front of him. So now he knows exactly what he's dealing with from a condition standpoint. Doesn't really worry so much about the payment, but he knows you're here for a headache and a fever. And then across the top, you see that these, whichever the configuration of the kit is, he has the ability to access any of these devices. As you can see, all the instructions for use are on each device as well, so there's no real issue, even though the community worker would have been trained in this. So today we're going to check, let's just very easily check the pulse oximeter. So you can see I've put it on my finger and started, push the button to start it, which would be what the community worker would do. Then we would start the doctor would start the process. And the Bluetooth is going from the device to the pad and now going into our system. This is live real-time data. So he's looking at the 99% oxygen level with a heart rate of 73 beats per minute and a perfusion level, which is the viscosity of the blood going through my finger. So this is a reading. If this is very low, if it's very cold, it would be a very different reading. So this gives him what he needs to know right now. So he's saying, if I'm looking for COVID symptoms, I'm looking pretty good because I haven't lost any of the oxygen level in my lungs. So if I stop that, the measurement's complete. Now I can continue on. I could take blood pressure. I can use an otoscope camera to look in ears or in my throat. I could use the stethoscope, which would give me live real-time breath sounds. So now they can actually, again, measure the type of breath sounds that they would normally do literally live in the clinic with hands-on and a thermometer. So these are all in the kit today. When I view the details, you'll notice down here that the pulse oximeter now, the reading that I just took is captured into this screen. So I have the date and time that it was taken. I have all the levels. Temperature, if we take the temperature, it would be in there as well. We take blood pressure, it would be in there as well. So anything that we do is captured. And an image gallery, if I happen to take pictures of your throat or your ears, those images would then be inserted here. So at the end of the call, then, as in any consult, it's the doctor makes their notes. So I'm going to say, prescribed ibuprofen 2 times a day. Return in 2 days. And that way we can take care of that. And now we have the notes in the system. Now we can export the summary, and this is important for several reasons. When we export it, it actually makes a PDF. And you can see when we pull up the PDF that you now have the notes from provider, you have all the patient details, you have everything that we did in the visit details, why they were here, and any results from the consult. the point here is that we can now take that PDF and we can then either print it out locally. Because if we in a lot of places there don't have electronic systems, we can export it to and send an email if there's an email to the patient or to any other system. We can actually take the PDF if it goes to an EHR, electronic health medical record system, and we can send it into that system as a document like this, separated and attached to the file. Or if we want to integrate this into the EHR for discrete data, we can take each of these data fields and we can then connect them in, and this can go straight into the EHR. And then you have a full record with all the data in the proper fields for management purposes. So we have full flexibility, whether it's a base level case or a base level situation, or whether we're into a very sophisticated data reporting backend. So any of those work, and we're flexible to do that. So at the end of this call, then we're done. We end the call. And you'll notice now that the care provider call center, that call is gone. We don't have any waiting. So it's very quick, very efficient, very simple to use from the doctor's perspective, very powerful because it actually gives eyes on the patient as well as provides all the diagnostic data. And we can move now very efficiently, move to the next patient, and doctors can move through the patient load very quickly. In addition, in that triage mechanism, you could now actually connect to we could connect to nurses who then could escalate if need be to doctors. We can also collaborate. So inside of this particular system, we can actually do joint calling. So now if you need to call in a specialist or a second opinion, that can be collaborated in just as you can in video conferencing. So it's very powerful, very flexible, and fits the bill.
Well, that's pretty impressive. Thank you for the demo. Obviously, we're seeing enormous investments from both the public and private sector to combat this pandemic. How do you see that impacting what you're doing? I would assume that this is something that would be highly useful right now, and something that governments and others would put in the field fairly quickly.
Well, the crisis has certainly created huge opportunities for rapid advancement because both governments and private funding are being made available very quickly. But the challenge is still to help our short term, because we got to try to control this virus, but we also don't want to sacrifice the long term. And by that, I mean, spectrum should be allocated to enable expansion of connectivity for healthcare and education. So when possible, these expenditures today to help battle this crisis should also result in core infrastructure that can expand our capabilities for tomorrow. Technology will continue to advance, but connectivity, access, and affordability are really the drivers for all these development. Our responsibility is to bridge the digital divide for everybody, particularly the most vulnerable around the world. And telemedicine is really a tangible example of how we can leverage these digital assets to physically impact our communities.
Well, this has been fantastic, and I really appreciate all the time and insight that you have. Clearly, you've been working on this for quite some time, and we appreciate the partnership and anything that we can do to help combat this current crisis. And as you say, certainly looking forward to accelerating the growth of this area, this particular field, because obviously it's the wave of the future, and certainly will help, combating the spread of anything, really, and certainly keep folks with connected care needs connected. So is there anything else you might want to add?
Well, I guess in closing, I'd just like to say, thanks for having me. But healthcare and education are truly vital to all people, and it's critical to all of our economies. We're really seeing that today. And it's critical to the advancement of our societies. So Viasat's on a mission to connect the world, and 19 Labs is on a mission to enable healthcare globally. So putting together the connectivity and the expansion that Viasat's doing with the value-added services of being able to deliver both healthcare and education literally to our communities to change lives is paramount to us.
Well, we, again, really appreciate it. We appreciate everybody joining us today. We're certainly happy to have people stick around and answer. We can answer any questions that you might have. One of our colleagues is going to be around to do that. So really appreciate it. Thanks for having us. Thanks to Forum Global for having this session. And we look forward to engaging with you in the future.
Hello, everybody. This is Satya, Narayana, Swami. I am from Viasat. I am Vice President and Country Manager for India. With me is Craig Noonan of Gale Tablet, who we just witnessed demonstrating a fantastic application with telemedicine on the video we just viewed. Craig, thank you for that.
You're welcome.
Yeah, when we build satellites, a lot of target for Viasat broadband is really on underserved and unserved communities, which find many such services out of reach for themselves. And it's exciting to see telemedicine being such a tangible example of how these benefits can be made available to all. Of course, we also see it extensible, and we'll talk about it, into education, into preventive care, into connectivity, government, etc. One question for you is, you mentioned that this crisis had brought about 5 years of progress in 5 months. What do you suggest to our colleagues who are witnessing this? How do we sustain the momentum around this? A lot of the colleagues here are in regulatory and policy matters that they're involved in. How do we sustain the momentum?
Well, I think the momentum's already started, of course. Funding is a big issue, so it's just allocating the resources from a funding standpoint. But like I said, the biggest challenge here is the ecosystem. So to be effective in healthcare, you have to have the connectivity for telemedicine, but you have to have the physician network, the community workers. You really need to integrate a pharmacy or be the delivery of pharmacy. And then you have to have your back-end record systems and reporting. So the biggest challenge is that there's no one lever you can pull to make it all work. So you literally have to have an integrated system. And one of the biggest challenges I see is you typically have people who know connectivity, and you have healthcare professionals who know healthcare, but they typically don't cross. And so you need an integrator or someone who understands both sides to be able to put it together. But the momentum started. We have lots of people looking at the problem. We have lots of actions happening right now in deployment, lots of pilots going on. So I think the momentum is already started. I don't think it's going to stop anytime soon. But funding is typically the biggest challenge.
No, that's great to hear. I think definitely funding in terms of public health care, as you pointed out, is something that everyone needs to focus on. From our own perspective on Asia Pacific, of course, we are bringing one of our satellites in the Viasat 3 constellation to APAC. Hopefully, but we would be working with regulators and policymakers in the region to make connectivity available Viasat 3 to the communities which could benefit from healthcare. Thank you. I see a question in our chat. I'm going to read it out for the audience. Does the patient use their hand phone only? Craig, I think this one's for you.
So the system is set up to where our Gale system is actually an application. So it's an app. And our app is resident or works on an Android tablet. If you're using an Android phone, we have the ability, we have ported the app over to a phone. So we could actually move from what I would call a clinic or a one-to-many. So you have a location where people come to the clinic. Or we can take the app and port it into an Android phone, which can give you a one-to-one. So you can actually use the app for remote patient monitoring on a one-on-one basis, or a one to a household basis. So it's totally flexible the way that we have built the application to manage the process. So you can use, even from an audio standpoint without video, you can use it all from your handset, just accessing into our system.
Got it. I see another question, which I will read out. Could you elaborate on the connectivity and bandwidth requirements on the patient side, on the doctor side? Craig, maybe you can start with that and I can add to it.
Sure. So it's actually very low bandwidth. The biggest consumption of bandwidth is for the video call, just as any other video call. And the platform that we use actually scales to the available bandwidth. So we can go probably as the optimum would be about 1.5 megabits up. So it's still very small. And so the 25, down and 3 up is plenty for this. But if you're constricted or restricted in a remote location away from, say, satellite that could give you that type of connectivity, it can go down to about 650 kilobits from the patient side.
Craig, in your experience, what difference is having video made to the patient-doctor experience?
Well, it really puts the patient at ease, because the patient is used to being interacting with a doctor. So from the patient's perspective, it's a confidence issue. From a doctor's perspective, it gives them the experience of literally being with the patient as they would be in the clinic. Having that data is critical. So as I said earlier, diagnostics by conversation is okay, but it really doesn't give the doctor the true look that he needs. Particularly, think about in a pandemic, he needs to listen to your lungs to see what level your lungs are filling with fluid. That is a very critical issue. He needs to see what on your pulse oximeter what your blood oxygen level actually is. Can't do that just through conversation.
No, that's a great point. I mean, we have seen that in other areas too. For example, like in education, where you're talking about online learning and so on. Video is such a critical part of the experience. Having that face-to-face contact really improves that experience. It benefits the person, the patient in this case, or the student in the other case. And that's also been a big focus for us, because traditionally satellite connectivity has been viewed as being slow. But what we have really been doing at Viasat is resetting the expectations there. We have focused our satellites to have the highest amount of capacity. As Amy mentioned, each Viasat 3 is over a terabit and is really built for supporting high volume use of video to enable these applications.
Yeah, the real-time aspect of the connectivity is key. There's no latency, there's no issues in how we do that, but it's a very powerful tool, and it actually, think about it, healthcare is personal. We talk about population health management, but it's still, when it's it's one-on-one, and that one-on-one care is what we do. We integrate the audio, the video, and all of the data so that it is literally a personal consult.
No, that's perfect. Another thing that struck me when I saw you recording patient history and so on is that in public healthcare, data is so important to the authorities, right? In terms of understanding, trends and so on. So would you care to comment on how you see that type of impact, positive impact coming on public healthcare from having more data?
Well, absolutely. To be able to, from a global perspective, managing the pandemic, the more we can get ahead and more data we have, the more accurate we can be in managing the outbreaks and the hotspots. So we need to be able to apply our resources effectively. So that's on a wide area basis. That gives us a good view. When the other issue, as we know in healthcare, is privacy. So one of the other key aspects that we do is we do not maintain any personal data. So we see ourselves as the platform, and the enabler of the call. But when we finish the data, or when we finish doing the consult, the data is passed to wherever the healthcare provider needs the data. We do not house the data. It doesn't go to our cloud. We are not a database management company, even though there are lots of people who are. We just believe that the data is personal to the patient and should be handled appropriately by the provider. So that's a little bit of a unique viewpoint, because as you can imagine, in today's society, data is very valuable. So, but we see ourselves more in the healthcare business and the connectivity business and integrating that, rather than being in the database management business.
Got it. You know, what during the video, one of the things that struck me was when you were talking about the guides. I remember in our experience in Mexico, we had gone out and done a survey, and one of the comments that sort of struck me and stayed with me was when one of the pharmacists stated that, you know, having that connectivity all the time made it easier for them to look up, say, for example, pediatric doses. They knew what the medicine could do for an adult, but when a child has it. So when I saw your guides, you know, just wanted you to talk about how that helps in, you know, educating people, how it helps in keeping the community workers retrained, and how, you know, being able to refresh them. How does it help with the whole education in the long term also?
So think of the guides in that whole section of our program as content management. So it can be used as education. It can be used to train and keep your community workers updated. It can also be a very effective tool in setting it up, or having your healthcare worker in the field educating the population. So there are questions that can be in there that are to a local community, because, for example, malaria might not be a big issue in the United States, but it's a very big issue in Africa, or it's a very big issue in certain areas. So it can be localized, and that's very very important. And it's a very easy distribution system. So as you know, the biggest challenge is just actually taking content and taking educational materials, and particularly in public health, and distributing them. So it becomes a very, very economic and very efficient way to localize this information. So we think it's a very strong card. One other sidebar to our particular platform, we can actually change the platform in the back and deliver education. So the exact same formatting and content management, we can actually do the same process and put it in schools in rural areas to be able to manage content from an education standpoint. So imagine having the tablet with some devices that are in a rural school that can have a dual purpose, both as a clinic and an educational tool.
I think it just illustrates how many different applications exist once you have the connectivity going in the community, and once you have the right applications. So thank you, Craig, again for giving a demo of a very impressive application. And I want to thank the organizers and our audience for their time today and viewing this.
My pleasure. Thanks for having me.